know for a fact that decades of criminalization has not worked. It has contributed to the shaming, marginalizing, and deaths of thousands of promising, caring, and much-loved individuals. It's time to move drug use away from a law enforcement model to a health-centered model.
BC's chief coroner, earlier this month, the province became the first to ask Ottawa for an exemption to decriminalize small amounts of illicit substances. Health experts say it could help stem the opioid crisis, and there are growing calls for more acceptance of psychedelic drugs too, like MDMA and LSD, to treat mental health. So, are we on the verge of a major rethink on illegal drugs? That's what we're going to be tackling on our Sunday conversation today. In Quebec City, freelance writer Nora Loreto, and from Qualicum Beach, BC, lawyer and musician Phil Dwyer. Welcome to you both.
Good morning.
Good morning.
Nora, start us off on this. Let's talk about how decriminalization might help to tackle the opioid crisis.
Yeah, by allowing individuals who use drugs, decriminalization would mean that they wouldn't have to hide it from law enforcement, that they would have, with other policies as well, they would have access, hopefully, to clean drugs. And both of these things have been what has been fueling the drug crisis, right? Poisoned drugs that have been very difficult to obtain, often thanks to public health policies or legislative policies that have made it difficult to extract drugs out of the pills that people have been using for a long time. And so decriminalization would completely change how we look at drugs in general in society and really break with a century of drug policy that says that drug users should be incarcerated rather than treated as someone who might be using other substances like alcohol or tobacco.
And my understanding that so much of the trouble that we're getting from overdoses, it has to do with the quality of the supply, that it's adulterated, and that decriminalization might not change that. But in terms of what you're talking about, Nora, the destigmatization of it, the ability for them to access health care, the ability to call for help if someone or a friend overdoses. Phil, your take on this?
Well, decriminalization would be a great step. I mean, it's any other health issue that resulted in the deaths of 20,000 Canadians over a 5-year period would have been dealt with long before now. It's criminal itself that we haven't been able to adopt better strategies here. And as Nora points out, this is something that's been going on for at least 100 years in North America. Initially, drugs were supplied, they were targeted to marginalized communities, and the enforcement of the drug policy has been aimed at those communities. Aside from decriminalizing drug use itself, the current issue with adulterated drugs could be dealt with by providing a safe supply of drugs. So working in tandem with the decriminalization could be actually providing safe drugs for people to use. And that's been tried in British Columbia recently to good effect, but we keep running into the same sort of moral panic that people feel. 10 years ago, the Supreme Court of Canada dealt with this on the safe injection site issue, and here we are 10 years later, still grappling with these same issues.
So whether it's decriminalization, legalization we can talk about as well, but I'm going to pick up on what Phil said there about the moral panic. It is an issue that can be raised as a specter, gateway drugs, young people, etc. Nora, if there are those thousands of lives can be saved, how do you make a case to deal with the very real concern that parents, people who deal especially with young people have about drugs and the path that can lead people down?
Yeah, I think we have to be really honest with ourselves. Drug use is widespread, and it's widespread among all social classes. People with more money have a better ability to hide their drug use or have a better ability to have access to cleaner drugs sometimes. And when we pretend that drug use is only something that a small number of people are doing, that it's marginalized people already that are doing, that we ignore the fact that that's not at all how people use drugs within society. Of course, the problem is that there are politicians that know that they can make a lot of political hay from the moral panic. And then the people that suffer from that are the people who fall through the cracks or who are using drugs as a way to self-medicate, right? But I think that we need to talk in society far more about how drugs are also fun and how people use drugs to have a good time, to alter their mental states of consciousness. And humans have been doing this for as long as humans have existed.
I've covered the drug trade at various big sections of my career over the years. And I remember years ago being in the back of a police car out going through with drug squad officers through what were then called crack houses and involved in enforcement. I remember a police officer telling me about 3 o'clock in the morning that society, we have this broad spectrum of ailments, and for so many of them, we're told to take a pill, take this medication, deal with this. And then there's this very narrow part of the spectrum that society tells people, no, you can't use a drug or a pill for that, and that it was the police officers' stated mission or the mission given to them to try to get people to come up to that line and stop at that line. Phil, can you talk a bit about society's attitudes to drugs and the stigmatization that accounts to some, and so many others, you get a prescription or you get something off the shelf to deal with whatever ails you?
Well, I mean, Nora makes a good point. This is an issue that transcends society, and because some people are dealing with they're using drugs to cope with trauma, poverty, things brought on by intergenerational poverty, mental illness, and those are the people that are easy political targets. It's easy to criminalize behavior among a class of society that doesn't have a voice. So that's just how things have occurred over the years, and it's a natural. It's a natural result of societal conditions that people would turn to that kind of relief, and to take that away, and to say that those people are bad for doing that, whereas the people that are relaxing with a single malt scotch after a hard day at work and the stock exchange is just ludicrous, and it has to stop, because it's just causing far too much damage to all of us. And I think that aside from the damage it's causing to the people who are using those drugs and are in that situation, it's causing a greater damage to all of society, because I think we all inherently know that the approach that's being used right now is wrong, and it's making us all feel ill about it, I think.
There is, of course, the differentiation to be made between decriminalization, which is essentially what we've been talking about, as opposed to legalization. Now we've seen marijuana go down the legal route. Can I get thoughts on legalization, especially when we start talking about some of the harder drugs? Does that shift the conversation at all, Nora?
Yeah, legalization definitely raises a whole bunch of other questions. And as we've seen with legalizing pot, there's still criminalization involved with it, because of course there's a legal framework. Now, there's a legal framework that says how many plants that you can have. It says how many stores a community might be able to have. You know, I was just in Ottawa and shocked to see how many stores they have compared to our 2 in Quebec City, or maybe 3. And so it's a completely different kind of regime than a decriminalization, which is to say that these issues should not be dealt by police and by the courts. I think that this step towards decriminalization is really important, and a safe supply, making sure that drug users are at the center of policy making, and that drug users are informing policy making. And if if in 10 years after decriminalization, there's a legal framework that might be able to be brought in that people think will actually do some good, then we can have that conversation. But we're quite far from that, I think. And what I would prefer to see is treating this crisis, the overdose and the poison drug crisis, as intensely as we've treated the COVID crisis, which of course we haven't seen that.
Phil, your thought on the legalization, and in particular around some of what may be at the further end of the spectrum in terms of the hard drugs.
Well, it's interesting to raise the COVID crisis, Nora, because in British Columbia, we have the same person, Dr. Bonnie Henry, who's dealing with the COVID crisis, who 2.5 years ago released a report which was very clear that this is a public health issue that has to be dealt with, and it has to engage the communities that are using the drugs. I honestly, personally, don't think that a decriminalization, although it's possibly far away in the future, is not going to lead to a stampede of new drug users and increase the number of people who are running out and using heroin or using methamphetamines. Most of the people that are engaged in that sort of thing, they're not doing it because it was something that they thought was a great idea and that they do on a daily basis because it's some kind of a choice that they make that is due to some inherent flaw in their personality or a defect of character. So if we did decriminalize or did legalize drugs, as long as we did it on the same basis of engaging people with services and treatment, I really don't see that there's a lot of downside. The more we can pull it out of the criminal world, the better. And I don't know what the statistics would show, but I don't believe that the relaxing of the laws with regard to marijuana has led to a huge increase in use.
Okay. You've given us a lot to think about. There's the issue around psychedelics being used as well for mental health. I think we're going to leave that for another day because that is another whole and emerging aspect of this debate. But there is so much, and I wanted to give the decriminalization and legalization its fair due, and you've done that. I want to thank you both, as always. Appreciate it.
Thank you.
Thank you, John.
Freelance writer Nora Loreto and lawyer and musician Phil Dwyer on The Sunday Conversation.